How will universal flu vaccines protect vulnerable people? Imagine a future where protecting those most at risk from the flu is simpler and more effective. That's what universal flu vaccines aim to achieve. They are designed to provide broad, long-lasting protection against all types of influenza viruses, unlike current seasonal vaccines that need to be updated every year. This means fewer shots and better defense for everyone, especially those who are most vulnerable. Older adults often face immune system changes that make it harder for their bodies to fight off the flu. Young children, whose immune systems are still developing, are also at higher risk. People with chronic health conditions like asthma, diabetes, or heart disease are more likely to experience severe complications if they catch the flu. Those with weakened immune systems due to treatments like chemotherapy are even more vulnerable. Current vaccines offer only moderate protection for these groups, and effectiveness can vary depending on how well the vaccine matches circulating strains. Sometimes, the vaccine's protection is quite low, especially against certain strains like a H3N2. Universal flu vaccines could change this. They are designed to target parts of the virus that stay the same across different strains, making them effective against all influenza types. If these vaccines reach high levels of effectiveness, they could dramatically reduce hospitalizations and deaths among vulnerable populations. For example, studies suggest that switching to universal vaccines could cut flu-related hospital stays in older adults by up to 95%. Even partial use of these vaccines could prevent thousands of hospitalizations and save many lives each year. Another important benefit is herd immunity. When a large portion of the population gets vaccinated, it helps protect those who cannot be vaccinated or for whom the vaccine isn't fully effective. This indirect protection is especially vital for vulnerable groups like the elderly or immunocompromised individuals. When more people are vaccinated with universal vaccines, the overall spread of the virus slows down, reducing the risk for everyone. Over time, universal vaccines become even more effective. As community coverage increases, the number of flu cases drops further. This cumulative effect means that vulnerable populations will see greater protection year after year, even if they cannot get vaccinated themselves. It's like building a shield around the community that keeps everyone safer. The potential impact of universal vaccines is impressive. They could prevent millions of cases, thousands of hospitalizations, and hundreds of deaths each year. This would also save billions of dollars in medical costs. For vulnerable groups, this means fewer severe illnesses and a better quality of life. Universal vaccines address many of the limitations of current flu vaccines. They are being developed to provide longer-lasting immunity and are designed to work well even in older adults or those with weaker immune responses. By focusing on the conserved parts of the virus, these vaccines avoid the problem of matching the right strain each year. Researchers have seen promising results in early studies, showing strong immune responses and protection against severe illness in animal models. In summary, universal flu vaccines could revolutionize how we protect vulnerable populations. They offer direct protection by being more effective, create herd immunity that benefits everyone, and provide ongoing, cumulative benefits over time. This comprehensive approach means that those most at risk from the flu will have a much stronger shield against infection. As always, it's important to consult healthcare professionals for personalized advice and stay informed through trusted health authorities about the latest developments.